A warm welcome to IGNOU. If you're creative, if you can write well, and if you can visualize, mass communication is the correct career option for you. I am going to talk about postgraduate diploma in journalism and mass communication, which is also the first year of MA program in journalism and mass communication. So any learner who has done a postgraduate diploma in journalism and mass communication is eligible to take admission straight away into the second year of our master's program in journalism and mass communication. Duration to complete this program is minimum 1 year, and because we have this inherent flexibility in distance education system, you can take up to 3 years to complete this program. The minimum eligibility criteria for taking admission in this program is bachelor's in any discipline. To give you a glimpse of what are the various components of this program, we begin with telling you what mass communication is, what are the various areas, various branches of mass communication. Then we go on to tell you about the various reporting techniques and beats of reporting, followed by media ethics, the principles, the codes of conduct that you must follow, and we also focus on the writing skills and editing skills for print media. Now, this program comprises of 8 courses of 4 credits each. 25% of the entire program is practical based. So we have 6 theory courses and 2 practical courses. This program is so designed so that it will be able to make you more employable in the market. So it helps you build a career in print media, in radio, television, new media, as well as the allied subjects of mass communication, which could be media marketing, advertising, public relations and corporate communications, event management. This can also help you become an entrepreneur in areas like photography or having your own production house and so on. So I hope that you will be excited to join this program, and we will be waiting to welcome you here in IGNOU.
Welcome to the session on concepts of supervision. As all of you know, supervision is very important, especially in the hospital or a public health area, and even the supervision of students in the field. Supervision helps the supervisor to know what is going on in day-to-day basis, where is the need for intervention of the supervisor, and what can be the future needs of the employee. We will try to learn about the basic concepts of supervision in this session. Supervision, as we know, is very important to provide quality health care to the patients. Because if people are satisfied with the care, they will actually come to that hospital, and which also improves the satisfaction of the employee, because they will feel satisfied in providing quality health care. It is very important for the organization to understand supervision is not only for finding the faults in the people who are working there, or supervision is not only to assess the needs, but also to see that how satisfied our patients and staff is. It is a very crucial and critical step, and the emphasis should be on organization, that how organization achieve the goals and how satisfied and what type of care the organization provides. So let us see first the meaning of supervision. It has been identified from the Latin word Super means from the above. And vision means to see. That means from the above, someone is observing the activities of the employee. And in management terms, supervision means overseeing the subordinates at work with authority and with an aim to guide the employee if she is doing right or a wrong thing. It is not finding faults. It is actually seeing against the performance, against the standards, or against the job responsibilities if the employee is able to do what they are supposed to do. These activities are carried out by the supervisor, and they have to understand they can supervise the subordinates who are directly under them. Like in the hospital, nursing officer or staff nurse is directly working under the senior nursing officer, or the old designation is ward in charge or the ward sister. So ward in charge or senior nursing officer is responsible to supervise the work of nursing officers in day-to-day basis, monitor it and see how the work is going on. The resources are available to them, what are their needs, and if they need on-the-job training, she will communicate to the higher ones, their ANS or the DNS. It is a process of guiding, helping, training and encouraging the staff or the subordinate to improve their performance in order to provide high quality, cost-effective care to the patients, because it affects the satisfaction of the patient and the satisfaction of the staff. A formal supervision process is very important to have in the work plan of the supervisor. And a formal supervision, there is always a person responsible. Means your ward in charge is responsible for quality services to be provided to the patient, because the nursing officer will implement the plans, but the senior nursing officer will plan it and see that those plans are being implemented, and supervision is part of her duties. No one will tell her that you have to supervise your nursing officers. It also includes monitoring day-to-day work. If they need any support, any guidance, any help, not only in providing patient care, but also in the personal issues, she has to be there for guiding and counseling. Supervisor play a critical role affecting the change both in the facility and within the healthcare system. As we see nowadays, many changes are coming, and those guidelines are being communicated through the supervisor so that the nursing officers or the staff nurse implement them. But as we know, change is very difficult to accept. Even if there is change in the timing of the shift, if there is any change in the practice, any change, there will be a resistance. But supervisor has to see how this change can be implemented to provide a quality care, and a change has to be in a very subtle way. That means slowly, by explaining to the staff, by taking them into confidence, a change has to be implemented in the hospital plan. Otherwise, if you will force them that this change has to be done, maybe the subordinate will follow for few days and they will get demotivated. It is very important to understand change will be there, and supervisor has to see how they convince their staff to adopt that change. And second responsibility here with the change of the supervisor is to guide and mentor them. How this change will be effective, how this change will help them to improve the nursing care and even the performance of the staff. It has been seen, if the staff is convinced what are the benefits of that change, they will accept it. Change requires the consensus of all the stakeholders, not only of the top level administrators, but all the stakeholders, irrespective, they are working at different levels, in different departments, even the patient and their relatives. How this change will affect the quality of care. Because the supervisor not only supervise the nurses, but also the subordinate support staff, and even they educate, they do counseling of the patients and the relatives of the patient also. So very important is to convince them also in a way that they are able to understand about that change. It's very important to understand another thing. Supervision can be internal supervision or it can be external supervision. That means internal supervision will be carried out by your ward in charge or by your ANS. Day-to-day supervision is by ward in charge, and external supervision you must have seen in most of the hospitals. The DMS or MS also comes for the supervision of the services, or they are being deputed from parent office or from different hospitals to see the supervision of the services which are being provided by a particular hospital. That means anyone can come to hospital A from hospital B to supervise the services and the type of, and you can say the satisfaction of the patients and the relatives, because they will take feedback not only from the staff but also from the patients and relative. So it is an internal supervision and external supervision. So supervision performance actually should be focused on, you can see that goals of providing high quality care, this should be very important. It has to be very focused at what are the goals of your institution. Process of continuous improvement of the staff performance. That should be the goal, that you have to improve the performance of the staff, not finding the faults. Encouraging the supportive interaction with the staff. If you are friendly, if you are supported, your staff will come and tell their issues and problems, and they will discuss, so that you are able to actually guide them and supervise them. Types of supervision. You must have seen various types of supervisors in your organization. Some are autocratic, some are laissez-faire, democratic, bureaucratic, and supportive. Autocratic means supervisors who says, whatever I am saying, you have to follow. You have to be obedient. Want everything to be done according to the instructions. They do not need any interference. Yes, sometimes autocratic supervision is good, especially during disasters, during emergencies. That time they cannot ask the opinion of anyone. But in day-to-day supervision, this system may not work effectively. Second is laissez-faire. Here, independence is given to the employee to complete the work, because supervisor know they are competent, they are experienced. Supervisor will come in between or will supervise now and then, and if he or she feels they need some guidance, he or she will give the guidance, and employees solve their day-to-day issues themselves. Democratic. This is very important. Here, the supervisor and the staff sit together, take decisions, and see how the work can be carried out smoothly and how the quality of services can be provided within the limited resources. Here the employees are encouraged to give their suggestions. It's not that all the suggestions will be accepted, but the supervisor listen to them. They discuss, and if feasible, they implement suggestions given by the staff. Bureaucratic. Here, the supervisor follows strictly the rules and regulation. If someone violates any rule and regulation, any disciplinary action is being taken against the employee. This also is not being encouraged so much, because here also staff get demotivated. This is also sometimes it is good in certain situations. If you see, the traditional approach of supervision is authoritarian or control supervision. It was thought that people do not know how to work, they need supervision and guidance, and if supervision is not given, they will get demotivated. Traditional approaches of supervision actually was criticized by people. People get demotivated if authoritarian or control type of supervision is being done. That is because someone is inspecting, someone is policing on you. So people do not like that. Even studies have shown 80% of people do not like traditional system of supervision style. Here, in traditional approach, there is the emphasis is on only improving the performance of the staff, finding the faults, and supervisor always come with a judgmental mind that they have to judge the person who is doing the work. Now the latest concept which has come into play, that is supportive supervision. This is the one which will actually help the staff to improve their performance. It is carried out with respect, with no authority, with no bureaucratic way, but to support the staff in a friendly way. Supervisory visits are used as an opportunity to improve the knowledge and skills and performance of the staff. Here the supervisor come with an open mind that they have to improve the knowledge and skills, especially the skill part. If they do not know anything, they will find out the cause and they will find out some solution to solve the issues, rather than pointing out what are their faults, why they are not doing this thing or that thing. It encourages open two-way communication. Here the subordinate can communicate their own concerns, why they are not able to do. Is there a shortage of resources, or equipment are not working, or the staff has never seen that type of case, or never worked on the new equipment and never received the training. They can openly tell the supervisor. And it helps to build a team so that the action is taken as a team to improve their healthcare services. It helps in the focus is on monitoring the performance to achieve the objectives of the nursing department. The most important thing is in supportive supervision, the supervisor use their own notes which they have observed, or the data is seen, or the nurses' notes are being reviewed, so that they know what type of care is being provided. If there is any deficiency, why there is deficiency? Because there will be regular follow-up of the staff and the supervisor will write the notes. And they will then sit together and review those data and the notes and will take the action. You can see how different it is from the traditional and the new modern supportive supervision. Supervisor and staff work together, which already I have told you, because the basic objective here is to improve the performance of the staff and to provide the quality services to the people, in that way improving the quality of the services provided by the hospital. So you can see in this slide the difference between the control approach and the supportive approach. The control approach put emphasis, I will summarize here, finding faults with individual. Supervisor is like policeman. It is episodic, problem solving. If there is any problem, the supervisor will come and solve it. Little or no follow-up is there, and disciplinary or punishment is given, and it is intended. But in the supportive supervision, main emphasis is on improving the performance. Supervisor is like a teacher, mentor, and to provide the support, use data or the previous notes to solve the problems, and the follow-up is regular. It is like a routine, not incidental. Whenever I feel like going to one ward, I will go. Otherwise, I know they are doing good work or I know they will not improve, so why should I waste my time? No, that type of intention is not there in the supportive. In the supportive, it is part of my duty. We have to supervise because the performance has to be improved. Process of supervision. Very important. All the supervisors should know what is the process of supervision. It needs planning. Process that supervisor used to identify a performance gap, what are the causes, and to create solution for closing those gaps is called as performance improvement. The concept of performance improvement is very important. In traditional way, it is finding faults. Here it is performance improvement. So the supervisor has to plan the visit. They have to put in their day-to-day plan in which ward, when they will go, why they want to go, and what they want to supervise. These are very important questions they have to put in. So, getting stakeholders agreed on the performance indicators. Whenever a supervisor make performance indicator, they have to be shared with all the nurses working in the department so that they know what are the performance indicator, what they have to perform to achieve them. Then only they will be able to perform. If they do not know what are the performance indicator, how they will achieve. So the supervisor has to take into confidence the stakeholders, their subordinate staff, their seniors when they finalize the performance indicator. And the stakeholders are your nurses, public health nurses, whichever department you are working. For the staff members to perform well, they must know what they are supposed to do. What I was telling you, that's why the stakeholder involvement is very important. Performance standards should be available with them. It is not that suddenly when doing a performance annually, they come to know they have to achieve this. Here they should know in advance what they have to do, and even training has to be given sometimes. Staff must know not only what their job duties are, but also how to perform them. Suppose you tell them they have to use some particular equipment to provide the care, or there is computerized equipment has come to check the vital signs of the patient, but they have never seen that type of equipment, or they have to maintain partograph in the labor room, but they do not know even what is partograph. So the training has to be given to the staff if they have to achieve those performance indicator. For the staff members to know how they will do, when they will do, and what are the difficulties they face, then only the desirable outcomes can be achieved if the proper training is being given, if orientation is being given, and if they are part of that in the beginning stage when the performance standards are being built up. Supervisor should continuously assess how the staff are performing, compare with the standards. Assessment can be done on an ongoing informal basis also, and more on formal basis periodically. We know that in the big hospitals it may be quite difficult to do on a continuous basis. Then a CNO or nursing superintendent has to delegate this responsibility to ANS. They have to see that ANS, who is having various units under them, they put this supervisory work in their work plan in a formal way so that it is an ongoing process, and they do a continuous supervision and they write their notes. Because if they are going in a 10 wards or departments, they will forget if they will not maintain the records. Methods of assessing performance: conducting self-assessment. If the staff knows what are our performance indicators, they can even do the self-assessment of their work. Then the feedback is taken from the staff, peer group, and from the patients and the relatives also. If the gap is being found, supervisor needs to explore why these gaps are. What is preventing them to achieve the desired performance? Sometimes the reason may not be available at the same moment. Then the supervisor has to go back and review all the notes and discuss the issue again with the staff or with some senior person and try to find out where is the gap and why is that gap is there, and try to fill up that gap. Once causes are identified, supervisor need to develop and implement the improvement performance indicator. This is the way to improve the performance of the people. Once the intervention is taken, this is not the end. Then it has to be seen. If training is required, training is to be given to the staff and follow-up has to be done. If follow-up is done, again it has to be observed, are they able to implement it, or again there are any gaps. If there are again any gaps, then again they have to think back why they are the gaps. Is it very difficult to achieve those, or training is required, or more support is required, or the staff needs much more on-the-job training. The skills are required to perform that. So that is actually the work of a supervisor. What I was telling you, planning where, when and what to supervise. That means where they have to go, what are the priority areas. It is the labor room, operation theatre, wards, emergency, casualty, and when they have to put in a work plan. It is not suddenly today I will go to medical ward. No, it has to be a part of a work plan. And what is the purpose of my visit? Are you going to visit and see the skills of the staff or how they are performing? Or the supervisor is going to see what are the equipments and the supplies available, if there are any deficiency, or there are any other issues during supervision they want to see. So that should be clearly highlighted in the supervisory plan. The qualities of a supervisor. There are many qualities, but some of the qualities I have just highlighted. Critical thinker, decision maker. They have to take quick decisions. Risk taker. If the supervisor is not risk taker, they cannot take the decisions. Problem solver. They should have the skills to solve all type of problems. Problems within the department, problem with the other department, problem with the patients, problem with the relatives, problem with the nurses in the same department. It can be your junior or senior. Effective communicator. How effective you are as a communicator and as a listener. More as a listener, you have to listen more rather than speaking more. How well you can write your notes, how well you can communicate in writing. Good leader. Take care of the staff welfare, guide and counsel them. Fair with everyone, treat everyone equally, trustworthy. That means you will not share the information with anyone else if they share something confidential. Take initiatives, empathetic, handle crisis, motivator, mentor. They themselves update their knowledge and skills. Honest, courageous, tactful, curious, good planner and organizer. And they have life skills, IT skills, and many other skills. Leadership skills, very important. So you can see in this way, today we have learned about what is supervision, what is the purpose of supervision, what are the types of supervisions, and most important, the modern concept of supportive supervision, which means you have to support the staff as a supervisor so that they are able to improve their performance, able to improve the performance of the department to provide cost-effective quality care to the patients. In that way, patient will be satisfied and the staff will be satisfied. The most important is supervision. Formal and informal it can be carried out. Formally, it has to be planned. When, what and why they are going for supervision. And supervisors also need training to supervise. Because studies have shown in nursing, 80% to 90% supervisors hardly have any training. They do not know how to plan, how to go and guide and mentor the nurses. That's why there is a conflict between supervisor and the employees. I think in this session will help you to conceptualize what is supervision and why you as a nurse, when you get promoted to ward in charges or senior nursing officer, you need the training as a supervisor, which will help you to become an effective supervisor. Thank you.